My name is Ruth Fox. I'm the Macmillan Skin Cancer Nurse Specialist in Northampton. Skin cancer is broadly divided into two categories, melanoma and non-melanoma skin cancers, and I'm going to talk about melanoma. Melanoma can be seen in an existing mole that you may have had all your life, or it can just turn up on clear skin. Often melanomas can be seen on sun-exposed areas of the skin, but they can actually be found anywhere on the body. There is another film about symptoms of melanoma in this series, what to look out for on the skin and when to seek advice from your GP. If your GP agrees that the lesion may be suspicious, then they will refer you to see your local dermatologist. When people see the dermatologist, there are questions about their history of sun exposure, any family history, and they have their skin fully checked. They then arrange for a biopsy to be taken of the suspicious lesion.
My name is Jessica Goodwin and I live in Eastbourne, East Sussex. Last year I was diagnosed with a malignant melanoma. There was a mole on my left arm. I had it removed 6 years ago and it was absolutely fine then, but it grew back, and the second time it was removed I was told that it was actually a malignant melanoma. I was initially quite concerned. I've got 3 children. My youngest was only just 1, so I was naturally concerned that if it did spread or develop, I would have quite a tough time ahead of me. That's probably played on my mind quite a lot, actually.
The majority of melanomas that we see at diagnosis are thin and have a good prognosis. The standard treatment for these lesions is surgery. Surgery is almost always performed under a local anaesthetic as a day case in hospital.
Following them removing it, they wanted to do a wider local excision to make sure that all the cells had been removed. So after the first lot of surgery had healed, I went back, it was probably about a month later, and had quite a bit more of the skin removed around the area. My Macmillan specialist nurse is called Tristan. After the stitches had been removed, I went back to see Tristan 3 months later. And every 3 months for a year I had to see him, and he'd check me over and make sure that everything was okay. He's asked me to check myself every month, check my lymph nodes and check all the area and make sure that I know my skin, know my moles and know what they look like so that I can pick up any changes quickly. He's been really, really supportive.
In some cases, if the patient is at high risk of recurrence and the melanoma has spread to the lymph nodes, they would be eligible for some clinical trials and may be referred for these by an oncologist. Most of the drugs offered in these clinical trials are newer targeted therapies which are based on immunotherapy or the genetics of a melanoma.
I'm really quite hopeful for the future. I'm really hopeful that as a result of my having melanoma, my children won't ever have melanoma, because they'll be educated about how to take care of themselves and how to keep an eye on themselves and watch out for any changes.
Don't be afraid of wasting your GP's time. The earlier we deal with melanoma, the better. So if you have a changing lesion, it's always best to seek advice from the GP.